Hi, I am Abrar. With my colleague Turki, we will present on systems approach to ensuring access and equity for vulnerable populations, focusing on rural communities, mental health, and aging population in Saudi Arabia. Saudi Arabia's healthcare system is undergoing a major transformation under Vision 2030. The Ministry of Health remains the main provider, citizens receive universal health care, and insurance is being expanded to cover residents as well. Despite the progress, challenges remain. Chronic diseases such as diabetes, obesity, and hypertension are rising rapidly. Mental health disorders are now among the top 5 causes of disability-adjusted life years, and by 2050, 1 in 4 Saudis will be over 60 years old. These shifts mean rural access, mental health, and aging care need urgent attention. About 16% of Saudis live in rural or remote areas. Services are delivered through more than 2,300 primary healthcare centers, but many are under-resourced. Mobile health units exist, but coverage is inconsistent. The digital divide makes it even harder for rural population to benefit from telemedicine, which is rapidly growing in cities. Workforce shortages are critical; most specialists are concentrated in urban centers. This results in delays, fewer treatment options, and poorer outcomes for rural residents. Mental health is one of the most underdeveloped areas in Saudi healthcare. Depression and anxiety affect nearly 20% of the population. There are only about 1.5 psychiatrists per 100,000 people, which is below the global average of 4.5. Most of them are in Riyadh, Jeddah, and Dammam, leaving rural population underserved. Stigma is another major barrier. Many avoid treatment due to cultural perceptions. At the same time, new opportunities are emerging: telemental health, school counseling, and workplace wellness programs. If scaled, these can make mental health part of the universal coverage. Saudi Arabia's population is aging. In 2020, just 5% were over 60 years old, but by 2050, that number will be 25%. Already over 70% of older adults live with at least one chronic disease, yet services are not prepared. Geriatricians are very few. Long-term care and palliative care are limited. Elderly in rural areas are especially vulnerable to isolation. As extended families become less common, caregiver burden grows. This creates an urgent need for comprehensive geriatric and community-based elderly care. Our country is already taking steps to address those challenges. Under Vision 2030, the Ministry of Health is restructuring and hospitals are being corporatized to encourage private sector growth. Digital health is expanding rapidly through platforms such as Saha, Tatamman, and Wasfati, improving access to telemedicine and e-prescriptions. Mental health is gradually being integrated into primary care, supported by the National Mental Health Policy. For rural and remote areas, mobile health units and new primary care centers are being introduced to improve access. Finally, there are pilot programs for elderly-friendly hospitals and community initiatives to prevent chronic diseases like diabetes, obesity, and cardiovascular conditions. Despite these challenges, Vision 2030 brings opportunities. Telehealth platforms such as صحة and Wasfati can be scaled for rural communities. Workforce development is critical. More geriatricians, psychiatrists, and community health workers are needed. Integrating primary health care centers with community services will ensure continuity of care. Elderly day centers, caregiver training, and intergenerational programs can improve quality of life. Finally, data and research on aging and mental health will help guide policy. Together, these can significantly reduce access gaps